So how do pharmacists have consultations within GP land? Let me explain. GP pharmacists don't actually just check prescriptions before they are signed or going out to the pharmacy. They actually run clinics as well. So for me personally, I run two specific long-term condition clinics, hypertension and asthma. These clinics are appointment-based and they run very similarly to GPs and nurses. So we have appointments for patients and it can be face-to-face or on the phone. Pharmacists are always consulting and they will always see patients and discuss their conditions or medications with them, and that classes as a consultation. I mentioned that I run clinics of hypertension and asthma, but I would also see patients for structured medication reviews, antidepressant reviews, hospital follow-ups, medrecs, medicines optimization, any sort of side effects or interactions that patients may want to ask me about. A common one actually is when patients want to speak to me during an appointment about some supplements or herbal medicines that they take and whether it's safe to take alongside their regular medication. Prior to the consultation, I will always check their notes to see what they're taking, why they're taking it, and whether they have been seen recently, because that's always helpful to see if there's anything that's been going on before my appointment. I will review their notes, their bloods if needed, observations, and decide whether or not their medication needs adjusting or removing or whatever. In GP land as a clinical pharmacist, there is so much communication with the patient and obviously the MDT team. A huge part of the role is explaining to patients what the medication is for, how to take the medication, any side effects or anything like that. And pharmacists work very closely with doctors and nurses within the GP practice. There is a lot of shared care decision making as well. There could be a scenario where I'm running a hypertension clinic and the patient's on like 5 antihypertensives and they have resistant hypertension. That means that the medication is not really bringing the blood pressure down. I would then seek for further guidance with a GP and we would come up with a plan together. So with regards to your question, how do pharmacists consult in pharmacy? Essentially, just like anyone else. This is the same in community setting, hospital setting. I'm not sure about industry, but most of the time, a pharmacist's job is to consult with the patient. Whether that be a customer coming into community and asking for an over-the-counter medicine, they would need to discuss that with the pharmacist. If it's something that's a P-med, another example is where a pharmacist works in hospital and they need to go to the ward to speak to the patient about their current medications. And then obviously in GP land with what I just explained. This is only a very small snippet of what clinical pharmacists do in GP land. Depending on which PCN you work for or GP surgery will depend on how varied your role is. But bottom line, there is a heap load of communication happening between the pharmacist and the patient, which is a consultation. If you want to find out more about GP pharmacy, do let me know. I'll be more than happy to explain a little bit more maybe. It's nice to see that GP pharmacy is becoming more recognised and known and the appreciation is coming through, which is very, very nice to see. If you have any questions, please do not hesitate to ask me. I'm more than happy to answer. But for now, I'll see you in the next one.